like to talk to us, please hit the raise your hand button and we'll get to those at the end. So one of the key points of our discussion about the truth of low back pain is that research really shows that exercise and good proper education is the most effective means for treating low back pain and produces the best results. So Jared, what does the research say about some of the exercises we're going to show today?
So, I mean, if we take this research article here, for example, right, it asks the question about who, right, would benefit from deadlifts, right? Who can be a part of deadlifting itself? And there are some criteria to whether deadlifting, squats, right, some of the heavy resistance training that we would want our patients to do. Some of them are not going to fit into that category, but the majority of patients with low back pain, right, or other different ailments as well, but sticking with the topic here, most of those patients are actually going to benefit from heavy resistance training using a progressive scale, right, of overloading when needed, right, to create a change, right, an adaptable change within the body, making them more resistant and more resilient to the forces that play, in everyday life, whether that be lifting something off the floor, something at work, sitting in your chair all day, we're doing a lot of computer work. Being stronger and more resilient is going to make it decrease your probability of having pain.
Yeah, great. So the first one that we want to talk about then today is the deadlift, and this is a pretty controversial one. You'll probably hear a lot of physicians, you'll probably hear personal trainers, even physical therapists will sometimes tell you that the deadlift is not a good exercise for you if you have low back pain. But the reality is, the research article we had up before actually shows that people who deadlift are typically going to show that have less low back pain than those who don't. And this is a key exercise that we implement with a lot of our patients and see great results with. So I'm going to turn it back to Jared, and he's going to demonstrate a little bit.
Yeah, so we won't go through all of these exercises here because a lot of them people have done before, but like Mike stated, deadlifts are very controversial and not a lot of people know how to do them correctly. And that can be a source of low back pain there as well, or source of knee pain or ankle pain, depending on what you're doing. So what we want to do right now is just go through the deadlift and then we'll cover the rest of the exercises. And if people have questions about specific examples, we can certainly jump into that there. But what we're going to do is you're going to make sure that you have the weight that you selected here or the weight that you have at home, something that you're able to tolerate at first. You're going to make sure you put that weight right in between of your feet. I like to say that the handlebar should be kind of right at your, right at the top of your shoelaces there, right? Or kind of right at the bottom of the shoelaces, in that area. The next thing you're going to focus on is pushing your hips back first, keeping a nice athletic position right with that slight knee bend, keeping the back nice and straight, and then reaching down for your target here, okay? So a lot of times you'll see a traditional deadlift where people are bending at the knees a lot. This one, we're keeping those legs a little bit straighter, bending more at your hips to grab onto your weight, and then pulling straight up to stand from there. This is a great exercise to work the entire posterior chain, hamstrings, glutes, and that low back, which is why we love it so much as physical therapists, because your body now becomes more resilient, like we said, to the forces being put on it. If you don't have a heavy weight at home, or you don't have weights at all at home, one thing that you can do is a gallon of milk can be just as effective. Your laundry basket can be as effective to kind of do these deadlifts and to do this hip hinge pattern. That's the big thing. I think the biggest takeaway is learning that hip hinge, being able to push your hips back without bending your entire spine as well. Your spine is staying straight, but your hips are the one that's bending and pushing straight back to get you into this position here. The more that you're able to lift, obviously, the stronger you'll be, and then that will make you more resilient there. So if you want to move on to the next one there, Mike, we can look at the goblet squat next.
Real quick, Jared.
Yep.
Talking about the deadlift, what are some activities that people might be doing at home that this would really help with that maybe they're struggling with at the moment?
Sure. Some of the ones that we noted before, doing laundry, lifting clothes up from the floor. If you're working and you work in a place where you need to lift a lot of boxes, right? UPS man, for example, or a lot of household chores and activities require you to get into this deadlift type of position. Now, I'm not saying that, if there's a pencil on the floor, you have to do a deadlift technique to pick up the pencil, bend at your spine, bend at your waist, just go grab the pencil. But for something that's going to be heavy, that you need to have proper position for, there's a lot of activities around the house, at work, that will require you to do a good deadlift technique.
Great. Thanks, Jared.
Yeah.
So how about the goblet squat?
So for the goblet squat here, as you can see from the pictures, right, the big thing that you're going to focus on is actually kind of changing up the hip position. So your hips are still driving back, but you're bending your knees a lot more here, driving the hips straight down, keeping the knees behind the toes at first, and then once you break that parallel or that 90 degrees, right, then your knees can come in front of your toes. A lot of times you hear like, no knees in front of the toes at all when you're squatting. And at first, sure, we do want to decrease the stress on the knee joint, but in this case, your knees are designed to go in front of your toes at a certain point of squatting. So the difference between a regular squat, like a barbell box squat, and a goblet squat is that the weight is going to be in front of you. Again, use your milk jug, use, if you have a baby at home, right, or a young child, you can grab on your chest there. You can put that weight on the front of your chest, which again is going to stress the low back and the posterior chain, things that we're working on here. It'll improve the low back strength overall. And also we're working on that hip hinge pattern again, which is going to be beneficial for getting down to pick up those clothes, picking up a child at home, even as simple as moving a chair, right? You can squat down to lift up that object and move it there.
Great.
All right, so the dumbbell weighted bridge I think is a good one. We talked a lot about, these are, the first two are those bigger muscle groups, right? Everything, the multi-joint movements. Now we're getting into stuff a little bit more specific. So we have the bridge here, which is designed to attack that glute max, right? Or that big glute muscle, the butt muscle, and kick in a little bit of the hamstrings. Again, working the muscles around the hip, affecting the low back by creating that strengthening component of the hips, relieving the amount that the low back has to work when you're doing any sort of activity. Again, focusing on posterior chain there. If you have the weight, you can use that same milk jug, or if your child will stay still, put them against your hips and you can kind of elevate that way to kind of create some resistance.
All right.
Yeah. All right. So
the lateral band walks.
Yeah. So lateral band walks is a good one because we talked about exercises already that are on the front, right? Working quads with the squats, talking about glute hamstring with your deadlifts, right? And your bridge. But another thing that we have to focus on is those hip abductor muscles, right? So the muscles on the sides of the hips. They are super important if you are a runner, if you are climbing stairs, if you are walking. They turn on reactively to make sure that your hips stay square to each other, right? You're not going to have a huge drop when you're walking. If you have that weakness and you have that drop in your hip, that's when the low back can really start to be involved. And that's when some of the pain can start to progress and get worse because of that hip weakness. A lot of times you'll hear your physical therapist say you may have a Trendelenburg gait pattern, which means that hip weakness is so significant that it's actually causing your hip to drop when you're putting your foot down there. So we want to make sure that we address this muscle to, again, limit the amount of extra force placed on the low back so that we can have normal movement and normal strengthening there.
Great.
Okay, so the plank, a lot of people know how to do a plank, or they've done planks before, and in my estimation of it, it never gets easier. It's always hard, but that's a good thing. So we're talking about working core strength here, right, and shoulder girdle stability, but we're mainly focusing on the ability to kind of contract those core muscles and work the core muscles the way that they're supposed to be. So subconsciously, there's muscles underneath, thick on the inside of the body, that need to turn on reactively. So when a stress is placed on those muscles, they'll turn on. That's what the plank is addressing. The rectus abdominis, those big muscles, the six-pack muscles, those you can kind of contract on your own if you're sitting there and tightening up nice and tight. But the ones deep to that help create stability of the lumbar spine, this is how we're going to work this. The same thing goes if you're doing a side plank. You're reactively turning on those muscles, again, creating that core stability, creating trunk stability, decreasing the excessive force on the lumbar spine. All right, so the Jefferson Curl, let's see if the video plays. This is big.
Yeah, it's looking like the video is going to play here.
Oh, thank goodness. All right, so we're looking at the Jefferson Curl here. It's a picture just wouldn't do it, so we had to make a video here. So pretty much what we're doing here is we're doing segmental mobility. And Mike, if you have anything, please chime in on this one. I know you like this one a lot. But the key to this, right, is to make sure that as you drop down and as you come back up, you're thinking to yourself, each segment of your spine is moving independently, right, of the other. So as you drop your head down, right, then you kind of slump the shoulders, you have the thoracic flexion, right, that mobility starts to come in, and then it transfers into the low back there. The weight that you're selecting is not super heavy. It's just enough to kind of assist you on the way down. What do you think about that one, Mike? Any other cues for that you would give?
Yeah, this is one of my favorite exercises, and I've had a lot of success giving it to people, and I think there's a lot of people who are fearful of this movement of bending over like this. And I think it's just important to understand for a lot of people that your spine is meant to bend in this way. It was designed to be able to do that, and it's not inherently dangerous to do that. One of the issues that people run into is because they're not strengthening those muscles in that way, they have pain when they go to do that movement. It's not the movement itself that's inherently dangerous. It's that we haven't trained our muscles and our body to be able to properly handle the loads that we're putting on it. So this is a great exercise for that, because we don't all move in a perfect world anyway. So while I love to encourage the proper, deadlift form, the fact of the matter is that not everybody has perfect deadlift form every time they go to bend over and lift up, right? So I want to strengthen those muscles in movement patterns and ways that they're actually using in their day-to-day life. So I love this one for that. I've even pushed the weight up to the point where they start to feel that those muscles are fatiguing out a little bit. So I'm actually okay pushing that a little bit. Okay. Certainly, that's down the road after you get used to the quality of the movement. And the other thing I'll sometimes do is if you feel like your hands are coming all the way down to the floor and you could keep going, put your feet on a stool to elevate it so that you can get that full forward bend to get the full range of motion.
Yeah, I think those are all excellent points. A lot of times too, it's just like building up confidence to be able to bend like this, especially after having low back pain. So, I mean, this could be the end of a progression of just kind of like slouching, bending, and then you have something like this where you're seeing how far you've come from like that acute low back pain, and you're very stiff and tight, and your orthopedic doctor might have told you don't bend at all, don't twist your back. So this can just be a confidence booster exercise there as well until you start to get to that heavier weight.
Yeah. And one thing that's common and in seeing this is people feel like they might have a stiffness or an achy pulling sensation. And in most cases, you're feeling that because you're not doing this movement enough.
Yeah, absolutely.
And your spine is now stiff and not able to do those movements as fluidly as it wants to. So if it's with sharp pain, then I'll usually back away from it. But if it's almost like a stiffness, achy pulling, it's probably healthy to do. And in a lot of instances, people actually start to feel better as they do the exercise, as things loosen up.
Absolutely.
Okay. Next one here.
So we talked, if we go through our exercise list here, right? Talked about the front of the thighs, back of the thighs, back of the hips, side of the hips. We talked about trunk stability, right, and trunk control. So now we're going to address that low back specifically. right? Those erector spinae muscles, those deep, quadratus lumborum, all those big ones there. And the lumbar extensions on a physio ball is a great way that you can isolate those low back muscles to begin to give that hypertrophy, to improve on that strength. So what you're going to do, right, you're going to take a physio ball just like in the picture. You're going to lay on top of the physio ball right at your hips. You're going to put your hands behind your head, right, behind your neck here, or across your chest, depending on your preference of positioning. And then you're going to lift your trunk up off of the physio ball, creating that tension in that low back. One thing that I always see too, and we try to cue to make sure that people in the clinic don't do this, is you got to keep your legs straight, or you got to keep them on the ground. Because if you start to lift up and you bend your knees, now you're not lifting at that low back anymore. You're just changing your angle at the knee joint. So in this picture, you see that the person's knees are slightly bent, and that's okay as a starting position, but that knee angle can't change after this point. So again, lifting straight up. I may demonstrate this one because this one's a little hard to kind of get a rhythm. So let me just kind of set up, Mike, if you have anything in the meantime about what you like about this exercise or any other things.
Yeah, no, I really like this one because, again, it's a movement that I think people who've had a lot of chronic back pain are initially a little bit nervous about doing, but it really is great for strengthening those low back muscles. It's probably not something I'm having somebody do day one, but it's something that I'm probably working toward with somebody. So if you're having, but it's also great for maintaining your low back health as well. If you're someone who's not currently having pain but just wants to maintain it, it's great for you. Then I would start you here.
Yeah. All right, so I'm going to keep my knees and my feet down here for this one. Right, hands are going to go behind the head, and then the key is now you can straighten your legs at this point, and then you're just going to lift your chest up. It's not a huge movement, but the idea is if you can get yourself up, right, you're going to isolate those low back muscles. They're going to turn on, get stronger in the process as the more that you do. You can always add resistance again to the front by holding onto a weight, and then we'll again challenge those low back muscles there. If you were flipping like I just was there, you can put your feet against the wall to kind of anchor yourself, or you can put your feet under something like in the picture to help kind of keep those feet stable. That way you're able to really hit that low back there.
Great. Thanks for sharing that, Jared.
Yeah.
So next we're just gonna we have 2 slides here, 2 or 3 slides here just on getting prepared to exercise, the principles of exercise, and how to dose these exercises when you're doing them. So after that, we'll be wrapping up and then turning it over for questions and a question and answer session. So Jared, what do you want to highlight here in these key terms?
Yeah, so one thing, the big thing I want people to know is, like, when we talk about all these terms, or your personal trainer or your physical therapist starts talking about these sort of things, they do have definitions to them, and they aren't as interchangeable as you may think, right? So this is going to be up on YouTube, so we don't have to take a picture of this, or you don't have to write all this stuff down. You can always look at it later. But the big thing is that I want to look at strength, right, which is the ability to exert a force on an object time dependent. Meaning, if you have a dumbbell and you're trying to push it away from you, it doesn't matter how long it takes to get from your chest to straight out. Are you able to exert the force and move it? That is strength. Hypertrophy, right, the term given to enlarge of the muscles, right? So as you build muscle, that's that term of hypertrophy. And the biggest thing in physical therapy that we need to do a better job of dosing wise is overload, which pretty much refers to assigning, like during a workout, a weight that is slightly over what that person is able to tolerate. The only way that you're going to adapt and to change is to overload your system so that you can get that input, meaning, like, if you're doing a heavy weight and you're overloading just a little bit farther than what you're used to be able to do, your body will respond by building more muscle fibers and then building from there so that you can now handle that new resistance. Overload and progression go together, just meaning that you're going to overload over a period of time. Yeah, so those are kind of the big highlights. Again, you don't have to remember all these terms, but just understand that overload is a very important principle to building strength, to building muscles, and making you more resilient.
Great.
Yeah.
And then where do people start?
Yep. So recommendations on where to start, right? This came right from the National Strength and Conditioning Association, right from their book. Okay. So if you're a beginner exercise, a beginner, your sets and your frequency per week is going to be 2 to 3 times a week. Nothing too crazy, but just enough where you're able to get a good workout a couple days a week so you can challenge your body. If you're going to go for any of these targets, usually I just push people towards the strength. That's easy enough to do, right? Strength or endurance would be kind of the areas that we would hit for, unless you're a higher level athlete who is progressing for some sort of competition, then we need to kind of include all of those variables there. But if we're just doing strength, right, your goal repetition is going to be less than 6 repetitions, meaning you need a weight heavy enough to make sure that you don't get more than 6. If you're able to do, let's say, a deadlift and you're aiming for strength and you do 15 and you're like, now I'm getting stronger. Technically, you will get stronger a little bit because all of these intertwine somewhat, but you're really going for muscular endurance. So you need to put the weight heavy enough or make the time that you're working long enough so that you can only get 6 repetitions. And then 2 to 6 sets is just something nice and basic. So if you do 3 sets of 6 repetitions of deadlifts, that is your building strength. And then if you do 2 to 3 sets, right, or 3 sets of greater than 12 or 12 or greater, then you're working muscular endurance there. So again, this is going to be on YouTube. You can take this for what it is and building into your own exercise program. This can be just some little values that you can start off with until you're able to overload and progress yourself.
Great.
Yeah.
And so that concludes the information that we have for you guys today. And if there's any questions, we will stick around for a little bit to answer those. Next week, we're planning on doing a discussion about the myths about exercise. So this is a great discussion about some of the misinformation that's out there about popular exercises that you may hear from trainers, from doctors, from, unfortunately, even physical therapists. So that is something that we will talk about next week. If you have any questions either on this session or have any questions that you would like us to answer during next week's session, please, I encourage you to reach out to us and email us those questions. We're happy to answer those for you. Follow us on Facebook, Instagram, and Twitter for updates on future education sessions. We're going to be doing these pretty much weekly, and it's going to range from question and answer sessions to larger discussions on specific topics. And for the most part, we will be posting those on our YouTube channel as well. So I encourage you to check that out at Kinetic TV. The great thing about these live sessions is that you do get an opportunity to ask questions in the moment. So I am going to see if anybody has any questions here. And it doesn't look like we have any questions. And just give me one moment. It looks like, yeah, so it doesn't look like anybody has any questions. If that changes, if something comes up after the fact, please email Jared or I. We're happy to answer any of your questions by email after the fact. You can also send it to our generic email, kineticptpa@gmail.com.